City of Jackson established a COVID-19 task force. Medical professionals on that task force include our state epidemiologist, Dr. Paul Byers, and local physician, Dr. Timothy Quinn. And Dr. Quinn joins us now via Skype. Dr. Quinn, thank you so much for being with us.
Hey, thank you for having me.
Let's talk about telemedicine. That was the president's message today as he addressed the country, was that we need folks to use telemedicine. Are these folks who he's talking about, are these people who might have the coronavirus, or are these people who, instead of going into their regular provider for just a normal checkup or whatever, or they're feeling a little under the weather, they could use this?
I just finished communicating with Dr. Clark Bronson, who's the executive director for the Mississippi State Medical Association. The Mississippi State Medical Association is teaming up with the American Academy of Family Physicians, Mississippi Division, and other organizations, and they're highly encouraging telemedicine by all physicians in the state. The main purpose is to allow people to continue to receive their medical care, but limit exposure, potential exposure, especially for the elderly coming into the doctor's offices and getting the infection of the COVID-19, which can be deadly for this population.
So we're saying then that that everyone that's got everything from a sinus infection to whatever should try to go ahead and use telemedicine other than going into their provider.
Well, during our meeting today with Mayor Chokwe Lamamba at his COVID-19 task force, we talked about strategies. We had the CEO of Merit Health Central, and basically what we talked about was individuals are being advised to call the doctor's offices, and this allows the doctors to triage over the phone. And in the event that someone has a high index of suspicion of having this COVID-19 infection, then that individual will be instructed. Now, most of the clinics, that include the Merit Health clinics, they're advising people to call before you go, and if they have this identification as being highly suspected, then they're pretty much given a mask before they even come into the clinic and immediately isolated in an area away from the other patients.
Right.
But for those clinics that have telemedicine capabilities, it's highly recommended that physicians use their telemedicine services, because the take home is we want to decrease exposure as much as possible, especially in the sick community.
Correct, right, okay. So we've known how they operate like that. Telemedicine, real good for people who live in rural areas, correct?
Most definitely, because what happens is if an individual has telemedicine capabilities with their medical provider, say they need a refill on medications for depression, anxiety, many medical conditions can be treated with telemedicine, and some of these physicians' offices are coordinating with local labs where you can go to the lab to get your blood work done, for instance, someone on thyroid medication. But right now, during this time where we want to limit exposure as much as possible, especially in people with medical conditions, telemedicine is the way to go as much as possible.
All right, one last question. They're opening it up now for Medicare patients, which is great news, correct?
Right, because this is our most vulnerable population. Most of the patients with Medicare, as we know, are over the age of 65, and a lot of them have medical comorbidities such as heart disease, diabetes, lung disease, history of cancer. These are the people that need to be protected the most. And if we can keep them at home, keep them on their medication, but keep them in communication with their physicians, hey, we're doing the best we can in this fight to keep our community healthy.
All right, sounds wonderful. Dr. Timothy Quinn, again, thank you so much for your advice. And of course, you know, we'll be speaking to you as we continue with this coronavirus outbreak. Thanks so much. And we'll be back right after this.
Hey, thank you.